Hi everyone, Gilliam Elliott here. In today's video, we're going to talk about what it really takes to build a legitimate medical tourism company. If you're thinking about entering the industry, you need to understand what the business actually involves. Medical travel is when patients leave their local area for treatment, either to another country or another state. And while many people associate medical tourism with cosmetic surgery and dental work, it also includes major procedures like orthopedic and cardiac surgery. It's important for you to understand that this is not just tourism, this is healthcare coordination across borders. As a medical tourism facilitator, you aren't just connecting patients with clinics overseas. You're managing patient intake, reviewing medical records, coordinating with international providers, and handling all the travel logistics. That includes flights, accommodations, and sometimes helping with visas. And more importantly, you're guiding the patient before, during, and after the treatment. And that carries responsibility. When a patient engages in medical tourism, they're traveling outside of their local healthcare system. They're in a completely different environment and often in a country they never visited before. If something goes wrong or unplanned on their medical trip, the first call they usually make is to you, the medical tourism facilitator. And because of this, you need to have safeguards in place to protect yourself as well as the client during the medical journey. You need to define your role carefully so patients understand you are a facilitator, not a medical provider. Without clear boundaries, you expose yourself to unnecessary risk. Most new facilitators underestimate this. They focus on launching a website before building proper intake systems. They advertise the procedures they offer before thinking through how they'll screen patients. They partner with overseas clinics based on price. They don't properly check the clinic's license, certifications, or doctor's qualifications. They don't clearly explain their role to the patients, and they skip written agreements that clearly define what they'll be responsible for. And that's where the problems begin. A legitimate medical tourism company needs more than marketing. You need a reliable intake process that gathers all the necessary medical information. You need a review process before sending patient files to a clinic. You need a process for selecting international clinics and reviewing their accreditation status and facility standards. And you need a plan for post-treatment follow-up. This industry is not just finding the lowest cost procedures overseas. It's about reducing uncertainty for patients. It's about building trust. It's about guiding someone through a complex medical journey in a way that feels professional and dependable. Many people see demand in this industry and assume it's simply a marketing opportunity. They think if they generate inquiries and they have overseas hospitals to send those inquiries to, they have a business. But marketing without preparation leads to instability, and instability in healthcare coordination creates exposure. There's no question that if you take the right steps, you can build a profitable medical tourism company because patients are seeking treatment abroad and the demand is clearly there. But demand alone doesn't create a professional company. If you want to build something sustainable, you need to understand the responsibilities before you launch. You need to define your role clearly, vet partners carefully, protect yourself legally, and present your service professionally. If you're serious about entering this industry, take the time to fully understand what the business truly involves. For those starting a medical travel company and looking for more advanced guidance, we've created a certification program that walks you step by step through building a company from the ground up. You can find more information in the description below. Thanks for watching, and I'll see you in the next video.